In sub-Saharan Africa, patients face limited access to quality and affordable healthcare, forcing them to rely heavily on private sector health products distribution, which is unfortunately also plagued by various deficiencies.
The public health systems are very underfunded, and health insurance access is not very widespread in Africa. I think layered on that are problems with the supply chain, right? There are many inefficiencies. Just being able to move goods from one place to another within Africa, because of challenges we have with our roads, with access, contributes not just to the cost, but just the delays in getting it there.
To address these challenges, an emerging ecosystem of commercial innovators is developing, aiming to sustainably scale disruptive technology-driven models. However, these advancements present certain obstacles as well.
Some of the most important strides they've made have been to use telemedicine platform as an example to increase access to many, especially in the underserved areas.
They have digital innovations that are able to track the commodities as they move, but also the condition, like the temperature, the humidity, and it's just really exciting to be able to sit at a spot and you see, how things are moving and in what conditions they are moving.
So these are all impressive strides they've made, but challenges still remain because there's a major disconnect between them and the large public purchasers like the governments and the donors and other agencies, global health agencies that can help them if there were partnerships to support their scaling and increase their reach.
To bridge the disconnect between innovators and large-scale purchasers, the I3 program was established in June 2022.
The 3 pillars of support that I3 provides are risk tolerant funding of $50,000 for both early and growth stage startup companies. The second pillar of support is access to markets. Access to markets is really around introducing these health tech innovators to large purchasers or governments or other people who are interested in their solution to address health issues. And the last one is development support.
What our mandate is basically help startups get investor ready. So we basically help them, fine-tune their business models, think about their markets, think about their customer, think about pricing. So the kind of support we provide is basically helping them to refine their thinking around the entire business models.
Following the first phase of implementation, the I3 program and its innovators have achieved remarkable results.
So we have been able to multiply our partnership with health facilities, doubling during the I3 program. And particularly, we are very excited about the full deployment of our gamified 3D simulations that permit women to be empowered and sensitized about breast cancer and facilitating them to gain access to health facilities for early screening and diagnosis.
So if in case someone does a screening and is suspicious or has doubt, the person can contact the numbers available in GMed apps and will be referred to nearest medical facilities for proper checkup.
I3 enabled us to be able to go to communities, doing medical camps in over 38 counties in Kenya, out of the 47 counties that we have in Kenya. And in the Access to Market event, we met with Madiro, and Madiro now introduced us to Dom Glasses. We become a distributor, part of the distributor network of affordable eyewear, from all the way from screening and then being able to fit in glasses. It has enabled us to reach more people, apart from just increasing visibility. More people now understand how we operate. It's more of a hybrid program, and they are seeing the need, and there is an impact that it has created in their lives.
Okay, this is a secret. I didn't tell anyone before, but I really didn't know the impact of I3 before starting that. And I thought, we wanted some exposure in Africa and that's it. So we applied. But we were surprised that the exposure by I3 really is something. From the beginning, it was clear that they are focusing on making sure being inclusive when it comes to gender. Also, throughout the program itself, the networking, the sessions, the mentor that was assigned for me, it felt like a very tailored to my need program. It's not one size fits all. All the learnings that we had from the I3 program, we'll still keep using it in the future partnerships.
Riding on the success of Phase 1, the I3 team now gears for phase 2.
So in phase 2 of I3, we're really focused on doing a couple things. The first is connecting companies that are on the leading edge to big customer groups. And the second thing we're doing is offering some financing and support around these companies. Finally, we want to change the ecosystem of global health that surrounds sort of these health tech innovators to shift how the healthcare system responds and engages with local innovators, bring them into the fold, and position them as part of the solution for the future of health systems.
And as many would say, it's really putting the S into the sustainable development.
If you see the I3 call next year, apply.
Are you an African startup innovating in healthcare solutions? The I3 call for applications opens the last week of January. Visit innovationsafrica.com/applications to apply and learn more.
We have started a journey,
But the work is not yet done.
Join I3 to go further.
Will you be a part of it?